Hello, we're back. We're going to continue our discussion on healthcare data. And of course, we have more databases, and these, of course, have things like lab, right? Each lab test has a unique identifier. They have a unique name. They have a unique CPT code, HCPCS code, right? And these are mapped to the LOINCs, right? We also have radiology information systems, right? And there are two components to radiology. We have the actual report, which is the radiologist interpretation of the film. And then we have the actual images, and the images are typically available through electronic healthcare record systems through the picture archiving and communication system, or as we refer to it as the PACS system. Then finally, we have the patient accounts database. This is all our demographic information, our financial data, payments, charges, credits, accounts receivable on a facility level or an enterprise level, accounts payable, right? Payroll, general ledger, all those things that we get into with the accounting. And then again, we've covered some of the different databases and registries we have. We have all different types of registries. Peace Health here in Eugene has a cancer registry. They also have a trauma registry. In most states, there's some sort of state registry about birth defects. Certain healthcare programs, such as Group Health, Kaiser, have diabetes registry. And as part of the FDA's efforts to make sure that medical devices and implants are safe, we have a registry on those. That way, if we ever have to pull these things, is what happened with certain artificial hips, right? Because they were titanium and little shavings of the titanium sliver from the joint were being shedded and causing problems. We can look at a registry, reach out to all those patients. We also have transplant registries, immunization registries. The list is nearly ended. One of the things we see happening with electronic health record is the rise of more and more databases that are disease specific. Some programs have an inflammatory bowel disease registry, breast cancer registries that are specific to those diseases alone. And then again, external data, internal data, right? Medicare, we have Medicare inpatient, outpatient, we have Part B, in other words, the physician part. We have state databases, right, for anybody who has on a state Medicaid plan. And we have the HCUP, right? More Medicare claims data, right? The MedPAR file will give us everything related to inpatient. That's the thing to keep in mind when we talk about the MedPAR. And then the standard analytic outpatient file is all the Medicare outpatient claims for a particular year. And then the Part B utilization that talks about the charges, the charge amount, the payment amount. And so what we do with that data is that's when every year CMS will go back and adjust the reimbursement based on some of this data. And some more examples of data you can look at for Medicare is data.medicare.gov, hospital compare data, nursing home compare data, physician compare data, dialysis, home health, and so on, right? And these are things we can actually download things in a text file, a CSV file, and look at things and compare. Moving from the federal level to the state level, we have different states, and states all collect their data in different ways. The state of Oregon data that's collected by OHA is dramatically different than the Department of Health Services data that the state of California collects. And you see some other examples here, just looking at the title of these. Utah, it's called the Office of Healthcare Statistics, Hospital Utilization, Ambulatory Center, Surgery Center. And they give you some query tools. They give you different ways of doing it in Massachusetts. The MassCHIP, the Massachusetts Community Health Information Profile. And in Massachusetts, for example, they have instant topics, and these are canned reports where you can click almost like a business objects or a Microsoft Access type of query and produce these kind of customizable reports. And then something we'll be taking a closer look at this week is the HCUP at ahrq.gov. And this gives us different data on hospital stays, readmission, emergency department, and so on. And here's a sample query. Outcomes for all discharges with standard errors, right? So on the y-axis, we have the rate of discharges per 100,000 people. And you can see it skewed. On the x-axis, we see the age grouping. And that's all I have for you. We'll see you online. Bye now.